Welcome, everyone, and thank you so much for joining. I'm Adelina Comas Herrera from the London School of Economics and the director of the Global Observatory of Long-Term Care that I run together with Naz Zalehi. And I'd like to introduce the observatory very briefly before going to today's presentation. So the Global Observatory of Long-Term Care is a platform to exchange knowledge about long-term care, and our aim is to bring together people working on research, practice, and policy on care all over the world, and to identify shared challenges and showcase how different countries and localities are addressing them, share research evidence, and facilitate collaborations. The observatory is open to everyone, and my colleague Naz will be sharing a link on how to join. And the way it works is that it's powered by people's wish to share their work, and this happens through interest groups. Like today's webinar, we have now 26 interest groups that are choosing topics or methods or even countries that they want to focus on, and then people can join them and be part of the conversation. We're also publishing blogs and method and topic guides, and we have 17 long-term care system profiles on different countries. And if you want us to share your work, please get in touch with us and we'll be very happy to do so. We have a webinar on Friday on older persons' disabilities and social protection in African contexts that you may be interested in. And I'm going to just highlight a couple of things. On the 28th of November, we're going to celebrate the International Day of Long-Term Care and Support, and we will be having an event focusing on changing the narrative on long-term care, how to move towards more positive and helpful framings that are very much evidence-based compared to some of the stigmatizing and catastrophizing way in which we often hear talking about long-term care. And I'm going to also mention this other webinar of the interest group on qualitative research methods together with the data science interest group. This is a nice collaboration that will be on the 10th of December on how can AI, whether AI can understand meaning and exploring large language models in qualitative research. And we welcome to visit the website. We do have even more webinars than that. So please take a look and feel very welcome to join any that you're interested in. And now I'm very happy to hand over to Chiara De Poli, who is one of the steering group members of the interest group on qualitative research methods. All yours, Chiara.
Wonderful. Thank you very much, Adelina. So welcome, everyone. This is, in fact, the first webinar we are running for the Qualitative Research Interest Group, and we do exactly what's on the tin. So we look at qualitative research methods in the context of health and social care research. And the idea is to think about in methodological innovations. And today, I think we're going to hear a bit about this. We reflect on the role of qualitative research to inform policy and practice, ethical challenges when doing qualitative research, cross-cultural comparisons, all sorts of things. If you have a suggestion for a topic for a future webinar, please feel free to get in touch. So today we host a webinar on qualitative process tracing. And our speakers are Professor Hareth Al-Janabi from the Health Economics Unit, University of Birmingham. And we have also Dr. Igor Shagalov from the same institutions. The presentation will last about half an hour. And then we have an opportunity for questions and comments. The presenters are happy to take questions at the end of the webinar. So hold back. If you have any burning questions you want to flag, please use the chat function and we will go through that at the end of the presentation. So that's all I wanted to say. Please, Hareth and Igor. When you're ready, feel free to start.
Okay, sorry, I was just unmuting myself. Okay, I've got some slides. I'll just share them. Is that working for everyone now?
Yes.
Yeah, great. Okay, So thank you very much for the invitation, Chiara, and yeah, feel honoured to be launching your methods series in the Qualitative Research Special Interest Group. So myself and Igor are based in the Health Economics Unit at the University of Birmingham, and we've been using process tracing for about 3 years on a Wellcome Trust funded project that I've been running about wellbeing investment in schools and workplaces, actually. But I think there are a lot of transferable lessons and interesting points about the methodology that we've been using and the fact that we've been applying it to a setting, I suppose, outside of healthcare that might be relevant for sort of people interested in doing social care research. I put qualitative in brackets because as you'll see as we go through the talk, I actually think it's more of a mixed methodology, process tracing, rather than a purely qualitative method. But certainly most of the methods that you use in process tracing do draw on qualitative traditions. So I'll talk a little bit about what process tracing is and where it's come from and how it's been used in health research to date. And then I'll start off by talking a little bit about how we were using it in the WISE project that I mentioned, this Wellcome Trust project on schools and how they invest in mental health and well-being. And then Igor will give a lot more detail in terms of its use in the more recent case studies over the last year or so. And then we'll have some reflections about the potential strengths and challenges with the method and possible application to social care. I'm really interested to hear all of your thoughts on that as well. So process tracing as a methodology has really come from policy studies. So not really a sort of traditional health services research method. And one of the sort of world experts on the methodology, Derek Beach, who we've been working with on the WISE project, talks about it as a research methodology for tracing the causal mechanisms or causal processes using detailed within case, and that's quite important, empirical analysis of how a causal mechanism works in that particular case study. And there are 3 types of process tracing. Process tracing work to build a theory about how a process or mechanism may work. Theory testing process tracing, where the aim is to test either a theory that has been previously developed by the research team or maybe an established theory in the real world. And then outcome explaining process tracing, where the aim is to explain an important outcome or phenomena within a particular case study with no sort of effort to generalize beyond that. So it's less about trying to develop a theory that travels beyond a particular case study and more about trying to explain a particular outcome within it. And we've got an example of what a process theory can look like on the right-hand side there from work one of our PhD students, Luke Henstock, did, applying process tracing to look at how some workplaces become high investors in mental health and well-being. So unpacking a relationship between a cause and an outcome into a series of intervening steps there, or episodes. And I think in terms of why process tracing is potentially valuable to research generally, it has the sort of capability to address those how and why questions that we often sort of black box in research. It's also useful as a potential technique to provide a sort of analytical description of social, political, and I think economic phenomena. So we're particularly interested in that in our unit as health economists. And also a framework of evaluating competing explanations as to why a phenomenon might be happening. So you might have 2 different theories about why something's happening in the world, and it offers a framework for testing which has more empirical validity. So it's a case study method, and in terms of what we mean by case studies, we're talking about something that tries to illuminate a particular decision or set of decisions. Why were they taken? How were they implemented? With what result? And it's case study research, of which I think process tracing falls into, is particularly useful when the context and phenomena are hard to separate. So when you might be studying something that's hard to abstract from the particular context within which it's occurring. And when we talk about case studies, these can be sort of more concrete things like studying how an organization worked, which we did in the WISE project implementation, or even an individual, or less concrete sort of issues around how decision-making works in a particular setting. A case study might be a community or a relationship. And case study research enables the nesting of a variety of different types of actual research methods. So case study is your kind of broad methodology, but you could be doing interviews as part of those, survey work, collecting documents and so forth, all with the sort of aim of triangulating towards an answer to your central research question. And I think one of the important things is about process tracing case study research is that individual case studies are like experiments rather than observations. When you select cases, you're not trying to use sampling logic to represent the total possible universe of cases, but you're trying to see whether a particular theory or phenomenon would replicate in contextually different circumstances or contextually similar ones. And in process tracing, we talk about typical cases where both the outcome and hypothesized cause are present, and deviant cases where one of those might not be present. And they help you understand both why whether both theorize about how a process might work and where it might break down, where the outcome's not observed. So why do we think process tracing might be useful in health? Well, health is a complex system where context and phenomena are often hard to separate. We have multiple layers of decision making, multiple sectors involved in it, and I think the same is also true of social care. And we're interested in how things work in individual cases, whether they be particular countries, and it's nice to talk to an international audience. Why, for example, publicly funded social care might evolve in one country and not another is an innately a case study-based question. Recognition of the limits of quantitative methods for understanding causal processes. So I think we have that in health, sort of acknowledgement of the importance of qualitative research, but also certainly in social care research as well. But the need to balance that with the need for evidence-based decisions. So, and in particular, I think process tracing offers quite a rigorous analytical framework to dealing with qualitative data inputs and other forms of data. So the central issue we're interested in our research project, the WISE project, was about better understanding how organizations, and in our case, schools and workplaces, actually invest in mental health and well-being. We might have this hypothesis that in the real world, organizations go through what sort of rational or problem-solving process, identifying a problem, like they try and spend a particular budget, defining goals, listing strategies to meet those goals, considering evidence and maximizing value. And in that case, we have quite a linear role for research in terms of informing that. But we know that this sort of process isn't how healthcare organizations necessarily work. And we would hypothesize that there would probably be deviations in the real world in schools and workplaces. And this has important implications then for how, as a research community, we support those organisations with evidence. So we're interested in the WISE project in better understanding how schools and workplaces invest in mental health and well-being. And this was the sort of focus of this 4-year Wellcome Trust Award that I've been running over the just sort of about to finish it in the next couple of months. And we've been using a range of methods for that, including Q methodology and think aloud interviews, but we're focused on the process tracing aspect for this seminar, and in particular our process tracing work applied to schools rather than workplaces. But we looked at how process tracing had been applied to date in the health literature, and then an empirical application of it to look at how schools invest in mental health and well-being. So firstly, in terms of how it's been applied in the health literature, we found we reviewed all applied literature that looked at uses of process tracing in health, and we looked at where it had been applied and how it had been applied. We found that there were 84 studies that had used process tracing in health-related settings, and these were highly concentrated in the last 4 or 5 years, so 61 studies since 2018. I think interestingly, often it was applied in just over half the cases in low and middle income country settings. And the focus of the work was often on a public health, health financing or health policy problem. But sort of worryingly, maybe from a methodological perspective, only 19 of those 84 studies provided reasonably transparent details of how they applied the process tracing in practice. And I think this was partly because with the policy studies literature, there's often a kind of black boxing of the methods that they say they applied a methodology, interviews or process tracing or something, and then they present the sort of rich descriptive results with very little detail about how it was operationalized. Nevertheless, we had 19 of these more detailed studies, and if you are interested in reading more on the application of process tracing in practice, I would sort of point you towards these studies. They were a mixture of outcome explaining, theory building, and theory testing. We found some were much more data dominant in the sense that they had a sort of well-described mechanism that they were testing, and then used tables and figures to explain how the data either confirmed or refuted different parts of that mechanism. And some were more narrative dominant, so maybe more like a traditional thematic qualitative analysis. We had these 4 elements of good practice: mechanistic theory, empirics linked to the theory, counterfactual thinking, and transparency. And studies rarely embedded all 4 of those that you would hope for in a process tracing study, but we did find some exemplars, and in particular this study by Alvarado that I've circled there is a great example of a kind of rigorous and transparent approach to process tracing, I think. So just for the last sort of 4 or 5 minutes before I pass on to Igor, I'll talk about the theory building work to use process tracing to build a theory about why some schools in England become high investors in mental health and well-being. And we did this particular work because really a lot of the sort of descriptive literature on priority setting focuses on healthcare settings, and a lot of it is rather than sort of explaining how priority setting works in practice, how resource allocation decisions are made, it's largely normative, coming up with sort of frameworks for improving priority setting, but with relatively little sort of insight about how it works in practice. So we set out to try and understand how schools who are charged in England with investing in their pupils' mental health and well-being, but given relatively little resources to do so, go about making these sort of resource allocation decisions. We had this work published about 9 months ago in Social Science and Medicine. So what was the process of the process tracing for theory building? So we ended up recruiting 4 case study schools. So we used a mixture of schools in terms of both primary and secondary schools, and ones that were part of a wider academy and ones that were local authority maintained. Within each of those case studies, we identified a primary contact, and we conducted between 2 and 8 interviews within each school and analysed between 14 and 41 documents to the schools, and conducted the work through in-person visits and face-to-face interviews. In terms of how the process tracing study worked, it was quite an iterative process. So there was an element up front to try and build what we called a mechanistic sketch from the literature about how we might hypothesize decision-making would work around resource allocation, recruit a high investing school to test this theory, collect the data, further develop that process theory, and then sort of iterate between some reflections and further integrations of the findings before moving on to the next case study. Through the 4 case studies, we identified 2 particular sort of pathways by which schools became high investors in mental health and well-being. Firstly, that a high prevalence of mental health problems in the local area catalysed the high investment. I won't go through the quotes, but we've got some nice quotes in there if you want to follow that up. And a second pathway through which a change in leadership or ethos within the school catalysed a high level of investment. And ultimately, we were trying to develop a single theory to explain mental health and well-being investment in high investing schools. And we brought those 2 pathways together as a single mechanism that we called care as capital. And we found basically that the decision-making process did seem to align with the sort of traditional rational problem-solving model at the front end. Schools would identify a problem, come up with sort of alternative courses of action, and try to seek some evidence. But then they deviated later in their decision-making process, rather than recognizing a strict resource constraint and prioritizing from within their budget. Scarcity of resources forced them to make an external search for resources and top up their internal budgets, and then build capital by building networks with other schools to promote mental health and well-being within their own school. So this mechanism we ended up being quite different, particularly at the back end, to that sort of theoretical problem-solving model of decision-making that we started with. So a couple of implications of the care as capital work. So I think it has important implications for the sort of research we do in particularly in health economics, that it's not necessarily about informing about the cost effectiveness of alternative investments, but maybe more about how schools can actively work and draw in resource from outside their organization in order to enter this virtuous sort of capital building cycle. But obviously the theory was developed through a limited set of schools, these 4 case study schools. So it does raise the question about how that theory travels, how applicable it is more widely, and why some schools don't become high investors. So if all schools have the same sort of policy pressure, why do some not become high investors? So that led to our second phase of the work, and I'm going to pass on to Igor for that. Igor, do you want me to progress your slides?
Yes.
Yep.
Yes, please, Hareth. Yeah, let's start with this slide. Thank you. Yeah, hi everyone. And let me start with a few words about the process tracing methodology we use in the schools work package. The easiest way to think about it is like their detective work, and we look really closely at clues, steps, and evidence that connect a cause of investment in mental health and the level of investment. And as you already know, process tracing is a two-stage approach. First, we build a theory. We do this by studying the schools that invest in mental health significantly. And this gives us a kind of ideal picture of how things should work when investment is high. And the second, we test the developed theory, and to this end, we refine it by studying high investment schools. And then we explore why some schools have failed to invest significantly by studying low investment schools. And we then compare high and low investor case studies. The first stage has been completed, and its findings have already been presented by Hareth. And my colleagues and I were testing the theory, and today I'm going to share how we did this and what we found. Please, the next slide, Hareth. Now a few words about the data we used in our work. It is based on a series of interviews with the senior leadership of 6 schools in Birmingham and West Midlands. We scrutinized the school's documents. We then observed how organized processes are in the schools. And finally, we also used the results of the survey. The next slide. Here are the characteristics of the schools that participated in our study. As you can see, they have certain similarities and differences. The first 4 schools are high investors in mental health, and the last 2 are low investors, but interestingly that they have larger budgets than the others. How did we rate their level of investment? The score came from our survey. It shows how well the school follows their whole school approach to mental health. The higher the score, the more a school is investing in mental health and well-being. All schools are the part of multi-academy trust and have good and outstanding Ofsted ratings, except the last one, which has requires improvement rating. And this logic reflects a wider trend in England where schools are joining the multi-academy trusts. Yes, the next slide, please, Hareth. What types of evidence did we use? In process tracing, evidence is usually grouped into 4 types. The first type is traces. This is the documents. The second is account, referred to interviews. Then patterns. These are figures, including quantitative survey results. And last but not least, sequence, which are interviews or documents that indicate the temporal order of events. So let me demonstrate what each type looks like using evidence for the hypothesis that investment is driven by a high level of deprivation in the school catchment area. So the example of a trace is there that in the school documents, the proportion of pupils premium is 49.2%, which is significantly higher than the national average. The example of account is the quote from the interview of their multi-academy trust CEO. As a partnership, our first aim and principle is children and families first, and they are all in very high disadvantage areas. The next example is patterns, and based on the index of multiple deprivation 2019, the schools is located among 20% most deprived areas in England. And the last one is the example of sequences. It's again the quote. The last 10 years or so, with the removal of so many services that made an impact for all families, and the increase in waiting lists and the increase in the being knocked back, I think a school had to pick up the pieces. So this is their quote from the interview with the head teacher, one of the schools. So process tracing allows us to combine different evidence types depending on the tasks you face and the resources at your disposal. That being the case, the question arises, what combination of evidence can be considered reliable or strong? And here is the next slide. In process tracing, evidence value is determined by how well it confirms or refutes a hypothesis. And to this end, evidence often assessed using tests based on Bayesian logic. However, such tests might be sensitive to gaps and inconsistencies in the data, and this sensitivity may vary depending on the field in which process tracing is applied. As you know, process tracing originated in policy studies, and therefore we have adapted it to specifics of health economics and developed our own system for testing the strengths of evidence. So this system is slightly simpler but maintains the rigor of process tracing, and it is presented before you. So we did not use the test, but instead focus on the diversity of evidence. If a hypothesis was confirmed or refuted by several sources or types of evidence, we consider this as a sign of the reliability of our inferences. Sometimes hypotheses do not work as expected or operate under certain contextual conditions. And to reflect these characteristics, we have added manifestation qualifiers or evidence qualifiers to our system. So these are adaptation and context condition. And this testing system is fairer for both in and between case analysis. Now let me demonstrate our findings. Hareth, please. Yes, the care as capital mechanism. So let's start with what we found in schools that invest heavily in children's mental health. So this allowed us to refine the developed theory. So this diagram shows the decision-making process behind those investments. So as I said, we call this model care as capital. The thicker the outline of a shape, the stronger evidence the element has. Gray shapes are based on our care as capital theory. White shapes come from existing ideas in rational choice theory. Next to some mechanism elements, you find the manifestation qualifiers or evidence qualifiers, which indicate that the element enacts differently than theorized or depends on contextual conditions. So what does this mechanism tell us? First, high investment in mental health is driven by the prevalence of deprivation in local area. The second, a variety of factors are involved in the investment process, including school and multi-academic trust leadership. Most are committed to the values of care and inclusive education, an important component of which is a sense of ownership of the local community. And these values underpin the investment and are reflected in the school and multi-academic trust ethos. Third, a commitment to shared values creates condition for alignment of goals between school actors, including a school and trust. The first usually seeks mental health support and the second seeks cost efficiency, and the common values place greater importance on mental health in decision making. And therefore you can see that some elements at this diagram are determined by contextual condition, the school ethos of care and inclusion. Fourth finding, schools don't focus much on cost effectiveness as described in the literature. Instead, they use the evidence of educational outcomes and discussion with the stakeholders in decision making like parents, pupils, etc. So the latter embedded the relational component into outcome indicators. Fifth, school leadership seeks and draws external resources, which is especially important when budgets are tight, and resource constraint as a contextual condition facilitate the search for external resources. School leadership also initiates the networking with other schools to share the best practices. And finally, when schools see positive results from their investment, they are more likely to keep investing. And this also strengthens the trust and norms of reciprocity between school staff, parents, and other actors. Let me now provide some evidence for our mechanism, and this evidence before you. We found that school and multi-academic trusts align their goals, and there are the quotes confirming this. So our financial director, the first quote, our financial director in the multi-academic trust is holding the budget and can be a tough cookie, and she is ultimately supportive. So if there are always around it, then she will try to get resources. Or the second quote, we have an overreaching strategy, obviously, for mental health and well-being that incorporates every single person in the organization. Yeah, the next slide, we said that the care as capital mechanism includes seeking and drawing external resources rather than relying solely on school resources. And these quotes on the slide attest to this. So the first quote is, there is a termly safeguard and lead forum, but it's a little bit more of one-way conversation. So we have started to have conversation and meet up with other schools and talk to us about what we do, build up a little bit of informal sharing ideas. Or the second quote, We have used different resources through the years. We had Mind provided us a few years ago with a series of resources, which were an early intervention universal offer for students, and we incorporated that. Now let's look at what happens in low investment schools and where our decision-making model starts to break down. The elements of the mechanism that are missing in low investors are highlighted here in red. So first, the trigger for levels of investment are equally the policy pressure and the prevalence of deprivation. But again, the latter one works in contextual conditions. The second, we found that schools and trust leadership had conflicting goals, which we believe is what breaks our mechanism down and prevents high investment in mental health. So the school aimed to educate and fight the fire of children growing mental health needs, while the trust likely sought economic efficiency. And the inconsistency of goals lead to this element working in two adapted but opposing forms. The first, centralized control by the multi-academic trust in the first school, and the minimal multi-academic trust involvement in the second. The third finding is the dominance of values of academic achievement and attendance instead of the values of care and inclusion. And this prevents the alignment between the school and the trust goals. Fourth, unlike high investors, low investors weight the evidence and of cost and effect of interventions. However, the local community didn't play a remarkable role in decision-making, and the relational component of investment in outcome indicators did not capture. And finally, fifth, low investment schools seek external resources as they are experiencing resource constraints due to centralized management and multi-academic trust rigidity or lack of multi-academic trust support. So external resources tend to substitute for the school contribution to mental health rather than complement it. And here is the next piece of evidence. So we have said that our mechanism is breaking down because of the misaligned school and trust goals. And this discourages high investment in students' mental health and well-being. And here are quotes from the school leaders' interviews that support our findings. So the first quote is that decision-making will come down to the multi-academic trust team, which will have a huge influence on that because they manage all the finances. Even if we did know and had a great idea, the other side of it is begging, borrowing, and stealing from the multi-academic trust finance team. Or the second quote, I would say as far as the trust is concerned, there is not a direct fund to mental health. And the last quote, the trusts are the people that have to report to the government about how the money works and how they have spent the money. What conclusions we can draw from our study? So here are the few suggestions that we believe could support schools in making decisions about mental health investments. The first, align school and trust goals. The goals of the school and the trust may be different. So school focus on student well-being, while trust may focus on cost effectiveness. It is important to bring these goals into alignment so they support rather than compete with each other. Second, support the search for external resources. We found that schools actively seek external resources to compensate for the lack of internal resources. So they seek to network with each other. So this means that policymakers could support this kind of search to bring additional resources and innovations to schools. Last but not least, third, encourage schools to consider both cost and outcomes in their decision-making. However, as our research revealed, the outcome measures should capture the relational component. Such indicators can be developed by the academic community with active participations from schools. On the next slide, I would like to share my reflection on the use of process tracing in the WISE study. Like any methodology, process tracing has its challenges and advantages. So we found a few challenges with process tracing application in the WISE study. So the first, process tracing takes time. This is true, but this careful step-by-step reasoning is what ensures that validity of its causal conclusions. The second challenge is that process tracing produces too much data. So the researcher must think like a detective, focus on evidence that truly informs the causal explanation. And the third challenge is that process tracing has no fixed rules because every case and mechanism is different, and this makes It's tricky, but also flexible, allowing the method to adapt to diverse evidence and contexts. The advantages of process tracing are, as we saw, process tracing is a rigorous approach to studying processes. Then process tracing achieves very strong internal validity by directly testing causal mechanism within cases, and meaningful external validity through analytical generalization. And mechanistic thinking is useful for policy because it explains how and why interventions produce change, identify points for improvement, and enables adaptation across contexts. And now quick a bit of thinking about how process tracing might apply to social care. So here's an example of how complex relationships, such as the care quality assessment framework in care homes in England, and actual care quality can be unpacked into causal mechanism linking them and then tested using the empirical record. So observable manifestations refer to specific evidence and sources that may be available to the researcher. And this example illustrates how process tracing allows us to build a step-by-step explanation grounded in empirical data to understand how regulatory pressure leads to quality improvement in care setting. And now I would like to hand over to Hareth, who will offer some concluding reflections.
Thanks very much, Igor. Yeah, this is our final slide. So I think we sort of set out at the beginning to think about, or beginning of the project, to think about whether process tracing would be a useful methodology for studying decision-making in health and care systems. And I think our sort of unqualified, well, our response is a qualified yes. So I certainly think it's a useful methodology for us to consider for our toolkits. But I think, as Igor was saying, it has been sort of, we've had the luxury of a 4-year project to apply it, and I think for many research projects you would want to think about maybe a more pragmatic starting point if you were trying to apply it within a sort of window of 6 or 12 months, like you often have available for an analytic work package. I think that it is a methodology that can be applied in different ways to different questions, and already we have the sort of theory testing, theory building, and outcome explaining options. And I think that by being a case study method and its sort of openness to different data sources, it is potentially very useful in health research, but also social care research, I think, where you're sort of working with quite a wide range of qualitative and quantitative data. Got some references from our talk there, but thank you all for listening, and really interested to hear your thoughts and questions.
Thank you.
Great. Thank you very much. Very rich presentation, I think, and very, very interesting. So can we open the debate? And if anyone in the audience has any questions or comments, please feel free to come forward. Naz, are you going to facilitate in this, or am I? No. Okay. So
we will be looking for questions and let you know, Chiara.
Okay,
so
thanks.
We'll be monitoring the chat and any hands.
Okay. Well, while people might start gathering some thoughts on this, while you were presenting, I wonder whether there is something to be said around how process tracing differs from the usual triangulation process that we might use when we work in mixed methods study. So you have a bit of quant, a bit of qual, you might have a bit different types of qual, different types of qualitative data, and which is something that in process tracing, at least in the version you developed and you work with, you have been doing as well. So I was just wondering whether there is anything you want to flag around process tracing and triangulation processes.
Thanks, Chiara. Yeah, no, I mean, I think that sort of triangulation is absolutely central in process tracing. So I think, as you say, you might do it in other studies, other case study research. How process tracing might differ is that you're triangulating with a specific aim of either a theory development, a causal theory development, or triangulating different sources of evidence to test a causal explanation or refine that causal explanation. So I think that triangulation process is in some ways probably similar, but you're trying to do it with a specific kind of theory in mind. I think, as Igor was saying as well, one of the ways in which we thought about it was that it would offer stronger sort of evidence for or against a part of the mechanism if we had data from more than one source that demonstrated the presence of that mechanism or something else going on. So we brought that triangulation into our formal decision rules for looking at the evidence there.
Thank you. Neil, do you want to come in?
Hi, Hareth. Thanks for the presentation, both. So really enjoyed it. I'm new to process tracing, so sort of naive question, but you mentioned it can be used for sort of theory building, theory testing, outcome explanations, outcome explaining. I guess if you're doing it for theory testing and outcome explanation, do you need to do you need to have used it for theory building beforehand, or can you sort of drop it into some other type of theory developed elsewhere that you want to use this methodology for?
Yeah, I mean, I think a lot of the practical applications have taken an existing policy theory and looked at how well that explains the sort of policy phenomenon that they were looking at. So yeah, for those theory testing or outcome explaining, you can absolutely test and establish theory. I think with the WISE project, because we had 4 years and because there wasn't really, I mean, we had theories about organizational behavior, but nothing really about school investment decisions, that we tried to build it more bottom up. But I think for a lot of more practical applications, you might start with an existing theory or two. They don't have to be kind of, I mean, theories can mean different things. And I think part of the analytical process is unpacking a theory into a set of causal steps. And I think you would have to do that in order to test it. But you can take the inspiration from the theory. It might be sort of supplier-induced demand, which is a popular theory in health economics. It might be some other theory from sociology or politics or anything about how the world works. And then for the analytical process, you would try and unpack it into a set of episodes and then test for the presence or absence of those.
Great, thank you. Simon. Simon has disappeared.
Thank you.
Okay, hi.
Nice. Yes, I'm joining from a social care provider organisation in Scotland. Really interesting methodology. Thank you very much for the insights. My question is about the potential application of the methodology to social care. I can see how it could very well be useful, but of course in UK, social care tends to be provided for organisations which are in competition with each other, perhaps in contrast to most UK education and health services. Given the depth of exploration that's required, for example, in relation to the qualitative measures, I wonder if you think that could be a barrier for applying the methodology to social care, at least in the UK, and if so, whether you would have any suggestions on how to get around those barriers.
Do you want to take that, Igor?
Yeah, if you want, you can start, and then I complement you.
So was your question, Simon, about the individual organisations in social care, because they're in competition, that each one's would require a separate study, and that might be quite data intensive, or?
Well, it's perhaps just more a pragmatic question, Hareth, about would participants buy in the same way? The methodology is, intensive, over time, detailed. It's the level of data gathered and the extent to which it needs to be shared, I suppose, that I'm interested in.
Yeah, so I think you can practically use process tracing as more like a maybe a methodology or philosophical way of thinking. A lot of the studies that we looked at didn't even gather any primary data, so they use sort of documents or existing sort of data in the public domain to kind of test the assertions. So if you were looking at how providers work and there was relatively good data publicly available for them, and you might be able to get quite far in testing a theory or developing a theory based on that, and you might be able to get more access to and others less access to. And I think the philosophy behind the approach, as Igor was saying, is it's more like detective work trying to solve a criminal case. And we know that, like, sometimes detectives have very short time periods to work with, and sometimes they have longer time periods, and you kind of make the best case you can with the data that you can gather in that time period. And I think maybe that it would be similar with the sort of challenges that you're talking about, that where there might be access problems or buy-in problems, that you would try and get as far as you could with the public data or something.
Nice, really helpful, thank you.
Yeah, just one more point. I just want to highlight it that yeah, you focus mainly on the not the volume of evidence or sources of evidence, rather than on the value of evidence itself. So to what extent it refutes or confirm your hypothesis, your alternative hypothesis, and your main hypothesis. So you have to be very specific and to identify the most appropriate evidence for you. So this also allows you to reduce your efforts when you try to find the evidence, to collect the evidence, and so on and so forth.
That's great, thank you.
Simon.
Any more questions? I have the feeling that there is a kind of rapid qualitative process tracing that might come next. Maybe just to a different version, a lighter version of the qualitative process tracing approach that you talked about. I just wonder whether you wanted to pin down a couple of things that, a couple of elements or a couple of methodological decisions that you would recommend in case people are working within very limited, they're working with very limited time, very limited resources, but still they wanted to use process tracing. And I see that Neil has another question. So maybe we can combine this last comment I was making with Neil's point before we wrap up.
Sorry, I was just happy if someone else has another question.
Please.
Okay, just to follow on a wee bit from Simon's question on the sort of collecting evidence, and when do you know when to stop? So, for example, if you collect evidence that confirms your hypothesis, but there might be evidence out there that refutes it, how do you have a good sense of, like, I feel confident in my claim that I can confirm this?
Yeah. So they're sort of slightly different, and I guess intention questions that are a bit in tension. But in terms of the sort of rapid process tracing or set of features, we identified four methodological features that you would expect to see in a proper process tracing study, about sort of specifying the causal process, linking the empirical data to those episodes in it, having counterfactual explanations considered, and transparency. So they would have, I think you can have those four whether you're doing a 6-month version or a 4-year version. So that's maybe your one, Chiara. In terms of how much evidence is enough, there's not a simple answer to that, I suppose, in the same way that there might be for a quant study. And I think the important thing is often process tracing studies are done with a single case study. So one of the things we tried to do in the WISE project with both workplaces and schools is trying to collect seeing whether the theory replicated over multiple case studies. And like any theory you have about the world, you you're sort of building up an understanding of whether it's traveling with each extra replication and where it might break down and why, rather than necessarily thinking of that as your stopping point. Yeah, I don't know if Igor wants to say anything about how much evidence you need to collect within a case.
Yeah, it's a good question actually. So yeah, as I said during the presentation, we developed the system, our own system, let's say, which allow us to identify the strands of evidence, which also highlight do we need to find something else, some additional evidence, so we can stop for this particular moment, and this evidence we think is sufficient. Yeah, so we try to, first of all, triangulate the different sources of information. And if we see that our hypothesis confirms with the different sources or different evidence, so they are aligned. So it was the sign for us that we did everything right and we can believe to the findings that we obtain. So, but as the process tracing is quite flexible methodology, and you can adapt it to the field, to the evidence, to the again resources that you have, and so on and so forth. So yeah, we try to adapt it to health economics specific and context, and yeah, so we found that it works, and I think the similar approach, the similar system to assess the strengths of evidence can be applied in social care, for example, or in healthcare as well. So health economics. Yep.
Great. Any final thoughts? Well, I have a final question, which is, are you going to, or do you have plans for writing up the methodological side of the work you did? So, I mean, clearly there is potential in having a bit of a methodological framework around how you do qualitative process tracing, I would argue. So I was just wondering whether you have any plans to write up a more methodological paper that building on the work you did, really.
Yeah. I mean, I suppose it's a two-pronged approach. So we tried to put as much about how the methodology worked in practice in the empirical papers themselves, and hopefully Igor's work will be submitted soon, and we'll have a lot of that. But in parallel, there's a lot of methodological literature that Derek Beach and others have put out there recently about how you do interviews for process tracing, how you sample for process tracing. But yeah, we have talked about the possibility of a sort of methodological reflection next year on its application in this context, and in particular the approach we took to multiple case studies and integrating survey data. So yeah, well, it's on the horizon. We want to get the empirical papers out first, I think.
Yeah. Great. Thank you very much, everyone. Adelina?
Yeah, from our side also, thank you very much. Please, a round of virtual applause for the speakers, and thank you everyone who's joined, and such a good start for the Qualitative Methods Interest Group. And we look forward to seeing you at our future events, and don't hesitate to get in touch if you want to get more involved with the observatory. Have a great rest of your day. Bye.
Thank you.
Bye-bye.
Thank you very much. Take care, everyone.
Bye.